I'm going to pick up where we left off in the last video. 7th line, patient is able to verbalize needs. Speech is clear and understandable. So again, we are writing a narrative, so we want to write in a way where the reader can understand what's going on with the patient. They can visualize it. I'm letting anyone who reads this know, whether it's a doctor, another nurse, and hopefully not a future attorney. I'm letting them know that this patient can verbalize their needs. If anything is going on with this patient, they're able to tell me and anyone else. Their speech is clear and understandable. There's no communication issues. Next, the IV. Anytime your patient has any type of equipment on them, you need to make sure that you document that. I have that the IV with normal saline at 75 milliliters an hour as ordered. So I throw that in from the last video. I'm showing that I'm a responsible nurse and that I have gone in to assess my patient, and I have made sure that the IV is infusing the correct fluid and that it's infusing at the correct rate. So you want to note the rate that it is flowing at, because sometimes the doctor changes the order and maybe the other nurse before you was too busy and maybe she forgot. So when you first go into that patient's room to assess them, you need to make sure that that IV is flowing at the prescribed rate. I also mentioned that it's infusing without difficulty, meaning that I've again been a responsible nurse and I've made sure that no issues are going on there. And I note the size of the IV in the location, which is the right forearm. It's a 16 gauge. And I educated the nurse to notify me if they notice any signs and symptoms that it has infiltrated. It's important that you document this education, because if a dangerous fluid is going through their arm and it may end up having an amputation or something, if you didn't document it, you didn't do it. So anytime your patient has an IV, we as nurses need to educate them, because yes, you've gone to school to be a nurse, but you are also a teacher, because if they don't work in healthcare, they don't know this, and it's our responsibility to inform them. Make sure you document that the patient understands the education provided.